Medical astrology treats the natal or transiting astrological chart as a rigid, mechanical, and highly precise biochemical blueprint. This table outlines the planetary pharmacy, showing how planetary bodies strictly govern specific nutritional vectors. Looking closely at the moon section, it explicitly rules bodily fluids, potassium, and vitamin B2, also known as riboflavin. When planetary bodies move into a hard aspect, a conjunction, square, opposition, or inconjunct, they create a state of geometric tension. This tension disrupts the availability of these exact biochemicals. By systematically tracking the moon's hard aspects to inner planets, practitioners can decode specific nutritional failures and predict critical surgical complications. Astrological geometry functions as a mechanical diagnostic tool to evaluate cellular survival and metabolic stability. Mercury governs the central nervous system, the astrological sign Virgo, and the nutrient thiamine or vitamin B1. When the transiting moon forms a hard aspect to Mercury, it flags a drop in systemic thiamine levels. This text outlines the first mechanical consequence, gastric atony. Because the moon's ruling sign, Cancer, controls the stomach, missing thiamine leaves the stomach muscles too weak and flabby to properly digest food. If Saturn is located in Cancer, hydrochloric acid production is compromised, halting digestion. The breakdown continues in the liver, an organ ruled by Mercury and Virgo, where thiamine depletion halts coenzyme production required for carbohydrate metabolism. If Jupiter or Saturn is implicated in this aspect, this specific coenzyme failure triggers clinical hypoglycemia. Additionally, because the moon rules potassium and Virgo guides the small intestine, this exact transit predicts chronic constipation. Ultimately, a Moon-Mercury conflict completely starves the digestive and hepatic systems of the vital biological fuel they need to successfully metabolize energy. Venus regulates the venous circulatory system, along with copper, niacin, and vitamin E. Looking at the Moon-Venus section, we see the primary digestive disruptions. A lack of niacin causes diarrhea, while low hydrochloric acid blocks the body's ability to absorb dietary copper. A prominent Venus dictates dietary cravings. It specifically drives a sweet tooth and prompts excessive intake of refined white sugar. Processing this excessive white sugar directly leaches potassium, the moon's primary mineral, out of the body's cells. If Mars forms a hard aspect to this configuration, that potassium drain triggers an imbalance with sodium. With sodium dominating and potassium depleted, the kidney's capacity to eliminate waste weakens. This causes fluid retention and edema. There are also reproductive risks tied to the loss of Venus-ruled vitamin E, including potential miscarriage or pituitary malfunction, particularly if Saturn is involved. This establishes a strict surgical rule: never operate during a Moon-Venus hard aspect. Post-operative healing requires a sextile or trine to prevent complications. A Moon-Venus affliction turns dietary cravings into a mechanism that dismantles the body's fluid balance and capacity to heal. Mars serves as the biological energizer. It specifically governs red blood cells, iron, and sodium. This text establishes the paramount role of medical astrology. Surgery is strictly contraindicated when the transient moon applies a hard aspect to Mars, such as a conjunction, square, inconjunct, or opposition. This geometric tension reliably dictates excessive bleeding, vascular inflammation, and surgical crisis. Conversely, a Moon-Mars sextile or trine ensures a quick, clean, concise cutting hand of the surgeon. The conflict operates on a nutritional vector. Mars governs iron, but Cancer rules bone marrow. During a hard aspect, these blood manufacturing components fail to integrate. Hypochromic anemia develops when a lack of moon-ruled riboflavin or excessive dairy consumption blocks iron absorption. This aspect also generates high blood pressure when an influx of Mars-ruled salt meets a deficiency of moon-ruled potassium, shattering the body's sodium-potassium baseline. For women, the combined lack of iron, vitamin B12, and fatty acids will disrupt menstrual flow and complicate pregnancies. A Moon-Mars conflict compromises cardiovascular stability, making it a high-risk transit for invasive medical procedures. In this framework, planetary geometries provide a direct readout of impending metabolic failure. A Moon-Mercury aspect tracks thiamine depletion, leading to gastric atony and hypoglycemia. A Moon-Venus aspect tracks potassium-leaching sugar cycles, resulting in cellular edema. A Moon-Mars aspect tracks sodium-potassium imbalances, warning of surgical hemorrhage. By calculating these specific geometries in natal and transiting charts, practitioners can anticipate physiological vulnerabilities and prescribe precise nutritional interventions. The transiting moon acts as a mechanical clock, marking the specific windows when the body can maintain homeostasis during an intervention.